Attention deficit hyperactivity disorder (ADHD) is often seen as a childhood condition, but it affects people of all ages and can look very different depending on the stage of life. While many associate ADHD with hyperactive children who can't sit still or follow directions, the reality is more complex, especially when the condition persists into adulthood. In both children and adults, ADHD impacts attention, impulse control, and emotional regulation, but how these symptoms appear, are managed, and affect daily life can vary significantly. Understanding the differences between ADHD in children and adults is crucial not only for accurate diagnosis, but also for tailoring effective treatment and support strategies that evolve with age. Here's a brief comparison of ADHD in adults vs. children's symptoms. In children, ADHD typically reveals itself through noticeable hyperactivity, impulsive behavior, and challenges with focus. Young kids may frequently fidget, run or climb excessively, interrupt conversations, and struggle with following instructions. Although inattention is a core symptom, it is often overshadowed by the more obvious physical activity and impulsive tendencies. These behaviors usually cause difficulties at school, where the need for sustained attention and compliance with rules can make ADHD symptoms more apparent. In contrast, adults with ADHD may no longer display overt hyperactivity. Instead, they often experience an internal restlessness or chronic inability to relax, while impulsivity can persist, sometimes showing up as hasty decisions or interrupting others. Inattention becomes the most prominent challenge. Adults may struggle with staying organized, meeting deadlines, remembering tasks, or managing time effectively. These difficulties can affect careers, relationships, and mental health, especially if ADHD was never diagnosed or managed during childhood. Understanding these developmental shifts is key to recognizing ADHD's full impact and ensuring individuals receive the help they need at every stage of life. Diagnosis: children are typically diagnosed with ADHD during their early school years because the structured environment of a classroom tends to highlight the symptoms. Academic challenges such as difficulty paying attention, completing assignments, and following instructions often raise concerns among teachers and parents. Behavioral issues like impulsivity and hyperactivity can also disrupt classroom routines, making it more likely that children with ADHD will be referred for evaluation. Early diagnosis in children is crucial because it allows for interventions that can improve learning outcomes and social development during these formative years. In adults, however, ADHD often is undiagnosed or is misdiagnosed for many years. Because hyperactivity tends to decrease with age and symptoms can become more internalized, adults may not recognize that their struggles with focus, organization, and emotional regulation stem from ADHD. Many adults only seek help when these symptoms start to significantly interfere with their work performance, relationships, or overall mental health. This delayed diagnosis means that adults may have developed coping mechanisms, some adaptive and some maladaptive, which can complicate recognition and treatment. Additionally, the way ADHD impacts adults often differs from childhood. Adults may face challenges related to managing responsibilities, maintaining employment, or sustaining long-term relationships, which can lead to stress, anxiety, or depression. As a result, many adults are diagnosed only after seeking help for these related issues. Understanding that ADHD can persist into adulthood and recognizing the subtle signs is vital for proper diagnosis and effective treatment, helping adults improve their quality of life and reach their full potential. Impact in children. ADHD significantly affects various aspects of their daily life, especially learning and social interactions. Difficulties with attention and impulsivity can make it hard for them to keep up with academic demands, leading to frustration, low self-esteem, and sometimes behavioral problems in the classroom. Beyond academics, ADHD can interfere with forming and maintaining friendships, as children may struggle with impulse control, emotional regulation, and reading social cues. These challenges often extend into family dynamics as well, with parents and siblings needing to adapt to the child's needs, which can sometimes create stress or tension within the household. For adults, the impact of ADHD tends to shift toward practical and emotional challenges that affect their independence and long-term stability. Career difficulties are common, as adults with ADHD may find it hard to organize tasks, meet deadlines, and maintain consistent focus at work. Time management problems can lead to chronic lateness or procrastination, which further complicates professional responsibilities. Financial issues may also arise due to impulsive spending or difficulty managing budgets, increasing stress and instability in daily life. Personal relationships can be deeply affected as well. Adults with ADHD often experience struggles with communication, forgetfulness, and emotional regulation, which can lead to misunderstandings or conflicts with partners, family members, and friends. The combination of these challenges can sometimes contribute to feelings of isolation, frustration, or anxiety. Recognizing how ADHD influences these areas in adulthood is important for developing coping strategies and support systems that enhance overall well-being and relationship satisfaction. Treatment for ADHD in both children and adults often involves a combination of medication, behavioral therapy, coaching, and lifestyle adjustments. Medications, such as stimulants or non-stimulants, can help regulate brain chemicals that influence attention and impulse control, reducing core symptoms. Behavioral therapy focuses on teaching skills to manage behaviors, improve organization, and develop better social interactions. Coaching, especially for executive function skills, can provide practical guidance on planning, prioritizing, and goal setting. Lifestyle changes, including regular exercise, structured routines, and healthy sleep habits, also play an important role in managing symptoms effectively. In children, treatment typically involves a strong emphasis on behavioral therapy and parent training alongside medication when appropriate. Therapies are designed to support the child's development in school and social settings, helping them learn to manage impulses and improve attention. Parents and teachers often work closely with healthcare providers to create consistent environments that support the child's needs. The goal is to equip children with tools that can help them succeed academically and socially while reducing frustration and conflict. For adults, treatment often shifts toward coping strategies tailored to managing daily responsibilities and stressors. While medication remains a common and effective option, adults frequently benefit from psychotherapy to address issues like anxiety, depression, or low self-esteem that may accompany ADHD. Coaching focused on time management, organization, and prioritization is especially helpful for navigating work and home life. Adults also learn to develop personalized routines and mindfulness techniques to better regulate emotions and maintain focus. Overall, treatment for adults is often more holistic, aiming not only to reduce symptoms, but also to improve overall functioning and quality of life. Thanks for watching. Stay kind, stay curious, and take care of each other.